Welcome back to News 3 Today at 11. We often focus on physical health, but what about our mental well-being? June is Men's Health Month, and within it, men's mental health is also highlighted, a time to raise awareness, break the stigma, and promote open dialogue. Dr. Jamal Lawrence is the founder and CEO of Harvest Health MD. He joins us now with more. Thank you so much for being here today.
Thank you so much for having me. Always an honor and a pleasure to be
Well,
here.
you know, I took this from a post that you shared recently. You said that the conversation with men starts by asking them a simple question: how are you really?
Yeah, absolutely. I think a lot of times we as people overlook just the business of life, that we don't connect on a human level. So I think it's really important to make space, you know, in personal relationships and also in the exam room, just to really allow a person, a patient, to be able to express the unsaid things that they're going through. A lot of times there's healing in just being able to have a therapeutic conversation about those things. Sometimes you don't even have to do anything. It's just the listening that helps people.
Yeah. And so it goes far beyond the surface level. How are you? It's not just being cordial. It's you really want to know how they feel. Far too often, men wait a while before taking action, which can lead to bigger problems. Why is this, and what happens when this occurs?
I think it's primarily due to the experiences that men have, and then also the sociological norms in society. You know, we expect men to be providers, to be protectors. We put up this wall and this armor, and a lot of times that doesn't allow us to be vulnerable. We're too busy trying to protect and defend. And that limits our ability to sometimes be in tune with our mental and emotional health. And so it's really important to kind of delve a little bit deeper into that, to pay attention to how you're feeling, and then also when you are having challenges, to get help.
Yes, that's the biggest part. So speaking of challenges, men have unique challenges that they face when it comes to health in general and mental health specifically, because they're less likely than women to seek help and are more likely to die by suicide.
Yeah, the rate of suicide in men is almost 4 times higher than women. And so when you think about, you know, why somebody would consider suicide, you have to think of the emotional toil that they're going through, the turmoil, and their inability to have the appropriate mechanisms and relationships to cope with life's challenges. You know, a lot of times women will gather around and they'll have girl talk and they have those outlets, and men don't always have that. Sometimes as a man there can be a sentiment of isolation when you're out there fending for your family, trying to provide. And so it's really important that we make a space and an opportunity to allow men to communicate. And sometimes it might take a little prodding, a little bit poking, but I think it's really important to have those relationships and to have those conversations and make a space safe for men to really communicate the things that they're going through.
There are certain mental health issues that disproportionately affect men, though. Let's talk about those.
Yeah. So one of those things are going to be substance use disorder. Men are more likely to turn to alcohol and to help cope with problems. And so that is a significant thing that we want to look at. Men are sometimes just not going to take advantage of the resources that we have out there for a multitude of barriers, you know, just again, societal norms, toxic masculinity, thinking that you have to do everything yourself. And it's okay to not be okay. It's not okay to stay that way.
Yeah. Something that I've noticed, though, in a positive way, is that more men are talking about going to therapy and talking about therapy openly.
Yeah, absolutely. We've seen that trend. I think that, you know, in society, in the U.S. in general, over the last 10 to 15 years, the dialogue around mental health has really expanded. You know, we're more open to talking about mental health, about having challenges, about where to get help. And I think that culture has shifted, and that's really going to help a lot of people be more attuned to what's going on and seeking help when needed.
So when it comes to black men, though, they experience significant mental health challenges compared to other groups, yet are less likely to receive or seek adequate mental health.
Yeah, and so there's a multitude of reasons behind that. When you look to systemic structures, when you look to racism and how that its implications within the healthcare system, oftentimes, you know, minority patients may not feel heard. They may not have the space in the exam room to discuss the challenges that they do have. And so it's really important that we try to mitigate bias as healthcare professionals and give them the opportunity to explore their circumstances and what's really going on with them.
Now I saw this on the National Alliance on Mental Health's website, and this is so powerful. This comment, it's not weak to speak.
Absolutely, absolutely. I think it's power, actually. It's power in expressing your vulnerability. That's the way that you overcome your challenges, is by being able to open your mouth. You've heard the colloquial term, closed mouth don't get fed.
Yeah.
Right, and so if you need help, if you're going through challenges, if you're experiencing something that's significantly difficult and impacting your life, you need to open your mouth. You need to seek those resources. You need to say that you're not okay. That's the only way that we'll be able to, reach out to provide support and to get you the resources that you need.
Dr. Jamal Lawrence, thank you so much for joining us. If you'd like more information on men's mental health or to check out Harvest Health MD's page, just visit our website, wsav.com/men's Health Month. We appreciate you so much.
Thank you so much for having me.